Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Over the last 24 hours, we have identified 875 new cases of COVID-19 in the province and completed almost 16,000 tests. That puts our current positivity rate at about 5.3%. Schools have resumed in-person classes. Right now, there are currently 4 schools on alert and 1 on outbreak. We have identified 6 cases in total. Our health system remains under significant strain. There are currently 820 people in hospital, including 137 who have been admitted to the ICU. Sadly, 23 new deaths were reported to Alberta Health in the past 24 hours. They ranged in age from 48 to 96, men and women whose passing leaves a hole in the lives of those who cared about them. I extend my sympathy to each person who is walking through grief right now, no matter the cause. As we hear every day about the impact of the pandemic, it is easy to start to tune things out. For example, for months now, I have been saying that we're all in this together, and I know that for many this phrase is wearing thin. For many people, this time we are in now is the most challenging moment in the pandemic so far. Few of us have ever lived through a time of adversity akin to what we are experiencing now, and hopefully we won't be tested like this again. But the phrase that I have often said is not a slogan. It is an irrefutable biological fact of COVID-19 that we cannot escape or choose to opt out of. COVID-19 shows us that a grocery store clerk is connected not only to the shopper, but also to the shopper's kids, their co-workers, and friends. It shines a light on the link between a long-term care resident and the worker who cares for them, as well as the worker's spouse, the co-workers of those spouses, and those co-workers' friends. COVID-19 doesn't care about anyone's race, religion, or political preferences. All that matters to it is whether an infectious person is close enough to another person for long enough to be able for the virus to spread. When cases rise, it is because we are infecting each other. When cases fall, it is because we are protecting each other. What we do with this reality is up to each of us. Business owners who choose to reopen, despite our current restrictions, are increasing the number of close contacts that happen in their community, possibly making it harder for other business owners if that means restrictions need to stay in place for longer. Business owners who prepare for a safe future reopening but follow the measures currently in place are helping their communities, protecting our healthcare system, and helping us get to a low enough level of community transmission so reopening can happen faster. Communities who support their business owners through this difficult time are making it easier for them to do the right thing. Twice now, we have reduced the rising spread by working together and bringing our contact numbers down. This is the only tool we have to control the spread of the virus until enough vaccine is available to protect a majority of our population. Until then, limiting in-person interaction is the best way to protect our health system and save lives. We are reducing the spread right now because of the choices that 4.4 million Albertans are making every day. It takes all of us. We are all impacted by the actions of those around us. It is by acknowledging we are all connected, by valuing those connections and strengthening them in any way we can, that we will get through the coming months. Like it or not, we cannot choose to opt out of community. We rise or fall together, and none of us can do this alone. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from Terry Reef at CBC. Your line is open.
Yes, hi, good afternoon, Dr. Hinshaw. Thank you for taking the call. Simple question here. Has the federal government delivered all the vaccine doses that were promised in its rollout, which my reading is about 41,000 doses this week, 13,000 last week, with with another 24,000 promised for next week. And for the record, how many doses have been delivered to date?
We can get you the exact numbers offline, but what I can tell you is that the doses that are committed to arrive at some point in the week that they're committed. My understanding is we have received one shipment this week, and we are expecting another one to arrive in the coming days. But we can give you those specific details afterwards.
Operator, could you put through the next caller, please?
Our next question comes from Kevin Nimick of CTV. Your line is open.
Hi, Dr. Hinshaw. We now know the cause of many more cases than we did a month ago due to contact tracers catching up on contacting people. How many cases have been linked to salons and barbershops? And could you also provide numbers for restaurants and other hospitality businesses?
The information that our case investigators are currently collecting is on our new active cases. And so it's important to remember that because some of those locations like salons, barbershops, and in-person dining in restaurants have been closed for many weeks, we would not expect to see those in our current trends. It's important to remember again that the intent of the current restrictions is to reduce in-person contact as much as possible across the province. And we are thankfully seeing our numbers trending in a very positive way. And we'll be making decisions as we go forward based on those trends. And of course, based on the information that we had from contact tracing earlier in the fall, that helps us get a sense of the relative risks of exposure in those different settings.
Operator, could you put through the next caller, please?
Our next question comes from Audrey Neva of Radio Canada. Your line is open.
Hi, Dr. Hinshaw. Yesterday you said that anybody who had an appointment for a vaccination would not be denied. However, today AHS reported that they were delaying or transferring some appointments because of lack of doses in certain zones. So I'd like to know, one, how concerned are you that Alberta will be able to vaccinate everybody that's lined up for a vaccine? And also, I want to know how do you approve of the rationale for Alberta to try to get shipments of vaccines without the federal government's help to go on its own? Is that a good route, in your opinion?
Thank you for the question. My understanding of the impact that, again, the shipment, those two shipments that were expected this week, one I believe has arrived, the other one likely will arrive later this week. My understanding is that the impact of that has been in taking appointments that previously were open and available and closing them down. So I don't believe there's a large number of people who were scheduled to show up and that their appointment has been moved. I think the impact has mostly been in closing down possible appointments so people can't book into them. So it will have an impact. Any time that we have to move that around, of course, it can take longer for people who are currently eligible to receive a vaccine. It can take longer for them to get that appointment and to get those doses. But again, Alberta Health Services is doing a tremendous job at making sure that they're constantly monitoring their supply, their forecasting for appointments, and trying to reduce any inconvenience in people having to be rescheduled. So they're doing that again by closing off potential appointments in advance so that people aren't inconvenienced. With respect to the question about procuring vaccine outside of the federal government program, it is, of course, all of our goal to get as much vaccine as soon as possible to make sure that whatever vaccine is procured is coming through the importation process, which requires Health Canada approval from a safety and regulatory perspective. And then in terms of the purchasing, certainly if there is approved vaccine that is available for extra purchase, again, I think it's all of our goal to be able to offer vaccine to as many Albertans as soon as possible, if that's able to be done through the licensed and regulated products course of action.
Operator, could you put through the next question, please?
The next question comes from Tyler Dawson of National Post. Your line is open.
Hey, thanks for taking the question. I just wanted to ask about the vaccine supply again. The Pfizer vaccine obviously arrived last night. The Moderna one has not. And AHS says that they're going to be completely out of the Moderna vaccine by later today. Can you just give me a sense of what that means? I mean, can the people who are scheduled to get the Moderna vaccine instead get the Pfizer one? What are sort of the logistical impacts of this?
Some of those logistical details would better be answered by Alberta Health Services, as they are doing that ongoing work to make sure that they're adjusting their planning based on emerging situations. If a person was scheduled to receive a Moderna vaccine as their first dose, and there is sufficient Pfizer, then they could be shifted into receiving that other vaccine. However, if somebody has received a first dose of either of those products, then their second dose would be with that same product. So again, the very detailed logistics of that would best be answered by Alberta Health Services.
Operator, can you put through the next caller, please?
Our next question comes from Jesse Weisner of Global TV. Your line is open.
Hi, Dr. Hinshaw. Thanks for taking my question. The vaccine will be offered soon to Albertans 75 and older, no matter where they live, and to those living on First Nation reserves who are 65 and older. I know the details are expected soon, but hoping to get an idea of the planning behind that. So how it's going to work. Will vaccinators go to them, or will they need to go to an immunization clinic? And how will these vaccines be administered? Will there be public clinics, or will vaccines be given by their pharmacist or family doctors?
As you know, the planning for what was originally called that Phase 1B that included community seniors over 75 and those living on Métis settlements or First Nations reserves who are 65 and over. That planning has been going on for quite some time, but the final details have not yet been sorted through, so there will be more information shared in the coming weeks about exactly how people can access vaccine. But some of the factors that are being considered are where there are populations of seniors who may have, for example, mobility issues or access issues, wanting to make sure that we're thinking of the mechanisms of delivery and the supports that individuals might need to make it as easy as possible for them to access vaccine. And again, I anticipate that more details will be firmed up and available in the coming weeks.
Operator, could you put through the next question, please?
Our next question comes from Lauren Boothby of the Edmonton Journal. Your line is open.
Thanks for taking my question. Just wondered if you can talk about kind of the overall picture of where Alberta is in the pandemic. We've been seeing some lower numbers, but as you spoke about yesterday, there's this issue of lower tests being run, also the shortage of contact tracers from before. So what are the overall trends? How confident are you in knowing what the trend is given the knowledge gaps? I have a second question. Are you planning to give everyone in Phase 1 of the vaccine rollout the second dose before moving on to Phase 2? Or are you going to start Phase 2 before everyone in Phase 1 has had the second dose?
Thanks for those questions. The first one with respect to the trend. We are seeing some positive numbers. The reduction in our positivity rate is encouraging. The reduction in our new daily cases is also encouraging. And our hospitalization and ICU admissions, which of course are the metric that tells us how much this is impacting our acute care system, are slowly coming down. What I would say about looking forward and predicting future trends is that the same message has always applied and continues to apply now, which is that as we're looking forward and considering what measures we might be able to ease at some point, that the actions that Albertans take once those measures are eased will determine our future. And so we are wanting to make sure, for example, that as we're easing measures, we're continuing to provide that messaging that no matter what activities Albertans engage in, they need to do so in a way that respects those public health guidelines, making sure that distancing is happening, masking is happening, that people stay home if they're sick, that they get tested if they're feeling ill. Because ultimately, if we open up and people are not following those measures, and we start to see our cases rise again with a baseline of over 800 people in hospital across the province, we can very quickly get into a difficult situation again with respect to our acute care system. So in terms of our future, again, I think there's lots of reasons to be optimistic, and Albertans, again, have shown that when we've worked together and followed these restrictions, we have brought our cases down. And that's not true of all locations around the world, but we can't ease up on following those public health measures or our trends will start to rise again. Oh, sorry, the second question. So in phase 1, people are getting their second dose either if they had pre-booked for an interval of 3 to 4 weeks, or if they live in long-term care and designated supportive living, they'll be receiving that second dose in that 3 to 4 week interval. For those who book their appointments, their first appointments starting yesterday, that second dose will be at around that 6-week interval. And so it will depend on when vaccines arrive, when those second dose appointments are booked, and how much extra supply we have as to when we can start providing first doses to individuals who are in those next phases. I anticipate that we will be able to start providing some vaccine, some of those first doses to people in that next phase before we finish the second doses, just because there is that time lag between those 2 doses. But again, that's exactly what all of that detailed logistical planning is for, so that we make sure we have enough vaccine both to give that second dose and first doses to as many people as we can, as quickly as we can.
Operator, could you put through the next caller, please?
Our next question comes from Alicia Corbella of Postmedia. Your line is open.
Oh, hi, Dr. Hinshaw. My question has a couple of components, all revolving around the Alberta Emergency Management Agency. Firstly, I'd like to know if you read Alberta's pandemic influenza plan of 2014 in the early days of the pandemic. If not, why not? And if yes, why wasn't it followed? Secondly, if it was updated to be more specific to COVID, why have Albertans not seen it? And thirdly, how often do you meet with the Alberta Emergency Management Agency?
Thank you for the questions. The 2014 pandemic plan was, of course, a large part of our planning in the early days. Much of that plan is relevant to COVID. Some of it is less relevant to COVID. We did not create a separate plan, but used the parts of it that were relevant, and the parts of it that were not relevant, we adjusted so that we could focus on the specifics surrounding COVID-19. We obviously liaised very closely with the Alberta Emergency Management Agency over the initial phases of the pandemic, and we continue to liaise with them. We have an Emergency Operations Centre in the Ministry of Health. And as you may know, in the plan, it does indicate that there is a lead ministry for every emergency response, and the Emergency Management Agency serves a supportive role for that lead agency. So our EOC has remained activated throughout the pandemic response, and we have used the Alberta Emergency Management Agency support at a higher or lower level, depending on what additional supports we need in our response.
All right, we've got time for 3 more. Operator, could you put through the next question, please?
Our next question comes from James Keller of the Globe and Mail. Your line is open.
Hi, Dr. Hinshaw. First of all, just to clarify, when we hear that the Central Zone ran out of vaccines and there's been specific sites that have run out in other areas, is that just the Moderna vaccine, or is Pfizer also part of that? And in the coming months, will this be a regular occurrence, like we run out, we wait for vaccines to arrive, we get more, and then essentially the whole thing just repeats over and over again?
I'll have to get those specific details about which vaccines they've run out of. Again, Alberta Health Services does that inventory management at a detailed level, so I don't have that information. Whether this will be a common occurrence in the coming months, I would anticipate that certainly in the coming weeks, this will be an occurrence that's relatively common, as again we work to get the doses that we have into the arms of Albertans as quickly as we can. And again, that's what AHS is working to manage, is making sure that they are increasing or decreasing the available slots for booking immunizations based on that forecasting. So trying to not inconvenience people as much as possible, but using up vaccine as quickly as possible where people are eligible for it.
All right, Operator, could you put through our second last question, please?
Next question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. As vaccinations ramp up, what planning is being done for immunization sites once we get beyond phase 1? Some jurisdictions in North America are looking to sports sites and large public spaces to set up clinics. So what's being looked at here?
We're looking at multiple options with respect to delivering vaccine as efficiently and quickly as possible. We know we have many providers who support our annual influenza program. Beyond, Alberta Health Services, Public Health, we have pharmacy partners, we have physician partners, and so making sure that we're considering all options as we're looking to future rollouts is critical. We have focused a lot of our detailed planning, of course, on our early rollout to make sure that we were doing that well and learning lessons from it. And as we're looking again to the future, as we anticipate having an increasing supply and ability to provide to more people, we are looking to do more detailed planning to make sure that all of those pieces are in place well before they're needed.
Operator, could you put through the final question, please?
Our final question comes from Lauren Pullen of Global Calgary. Your line is open.
Hi, Dr. Hinshaw. Thanks for taking my question today. Just another question on the vaccine shortage that we're seeing. When we inquired with Alberta Health last week, before vaccinations were expanded to those other frontline workers, that happened on Friday and earlier this week, the statement that we received was to start immunizing all these workers immediately. We would be forced to immediately stop immunizing residents and staff in long-term care and designated supportive living. We're now running into those shortages that we have been seeing and have been mentioned throughout this press conference. What changed since we got that statement on Wednesday to allow the expansion of these other healthcare workers? And do you think we possibly ramped up too quickly, or the province expanded vaccine distribution to too many people in this phase without a guarantee that there would be enough doses?
The statement last week, again, I'm not familiar with that particular statement. What I know is that the message that I have communicated to Alberta Health Services is that residents in long-term care and designated supportive living facilities are a top priority, and that the rollout of vaccination to those individuals did need to be the number one goal as they were looking at rolling vaccine out as quickly as possible. And I believe that's reflected in the fact that they have been able to hit the mark of making sure that they are giving that particular group of people access very quickly. With respect to the question on whether or not we expanded too quickly, it's always a balance. And one of the challenges, if we have a smaller group of people who are eligible, when we don't necessarily know how quickly they may be coming in to take up the vaccine, we wouldn't want to have appointments that could have been taken left empty because we don't have enough people coming in the door. We also, of course, want to avoid a situation where we have so many people eligible that they're needing to wait very long times to get their appointments. And we're trying to strike that balance where we have enough people eligible that we're able to always fill our available appointments. So there will always be a little bit of a need for people to wait and be patient. But of course, we always want to expand on that leading edge so that we're not leaving appointment space open and unfilled.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.
Thank you.